Bismillahirrahmanirrahim. Today we will discuss with us the arm. At first, we have in the arm two intermuscular septa, medial intermuscular septum and lateral intermuscular septum. The two septa divides the compartment into anterior and posterior compartments. This is the lateral intermuscular septum and this is the medial intermuscular septum, with the humerus divides the arm into anterior and posterior compartments. Now we will discuss some of the bony special features which will help us to study the origin and the insertion of the muscles. At first, this is called, as you know, coracoid process. It's called coracoid process. This is a glenoid cavity. Above the glenoid cavity, there is a small tubercle called supraglenoid tubercle. Here, this is the medial border of the humerus. This is the medial border of the humerus. As you know, this is the coronoid process. This is the coronoid process. And this is the ulnar tuberosity. This is the ulnar tuberosity. And this is the radial tuberosity. The first muscle is biceps brachii. The biceps brachii has short head and long head. The short head arises from the tip of the coracoid process of the scapula, but the long head takes origin from the supraglenoid tubercle. The supraglenoid tubercle is a small tubercle above the glenoid cavity. The tendon of long head of biceps enters the capsule of the shoulder joint, so it is intracapsular, but it is surrounded by the synovial sheath, so it is extrasynovial. The insertion by a tendon and aponeurosis, the tendon called biceps tendon, which is inserted into the radial tuberosity in the posterior rough part of the radial tuberosity. The second insertion is by the aponeurosis, which is called bicipital aponeurosis. It fuses with the deep fascia of the forearm. This is the short head, which takes origin from the coracoid process. This is the long head, which takes origin from the supraglenoid tubercle. It enters into the shoulder joint, into the capsule, so it is intracapsular and extrasynovial. This is the biceps tendon inserted into the radial tuberosity, and this is the bicipital aponeurosis, goes to fuse with the deep fascia of the forearm. The nerve supply by musculocutaneous nerve. The nerve supply is by musculocutaneous nerve. The actions: simply this muscle do supination and deflection. Supination of the forearm and deflection of the elbow joint. Also, the short head helps in flexion of the arm. The long head also keeps the humerus in contact with the glenoid cavity, especially during the movement of the shoulder joint. Second muscle is called coracobrachialis. The coracobrachialis, it takes origin from the tip of the coracoid process, in common with the short head of biceps. It is inserted into the middle of the medial border of the humerus. The nerve supply also from musculocutaneous nerve. Its action simply flexion and adduction of the arm. This muscle, this is the coracobrachialis muscle, takes origin from the coracoid process to be inserted into the middle of the medial border of the humerus. The third muscle is called the brachialis. It takes origin from the lower half of the front of the humerus and also from the medial and lateral intermuscular septa. The insertion into the front of the coronoid process of ulna and also to the ulnar tuberosity. The nerve supply has double nerve supply for musculocutaneous nerve and from radial nerve. Its action, it is the main flexor or the principal flexor of the elbow joint. This is the brachialis muscle. It takes origin from the lower half of the front of the humerus and it is inserted into the anterior surface of the coronoid process and the ulnar tuberosity. The last muscle is called triceps. It is present in the posterior compartment and has 3 heads. The long head arises from the infraglenoid tubercle, which is the small tubercle below the glenoid cavity. The lateral head arises from the oblique ridge above the spiral groove. We will see it soon. The medial head lies beneath the other 2 heads and it arises from the back of the humerus below the spiral groove and also from the medial and lateral intermuscular septa. Insertion. The 3 heads join together and they are inserted by a tendon into the olecranon process of ulna. Nerve supply, it is supplied by radial nerve. Its action, it is the main extensor of the elbow joint. The long head also helps in adduction of the arm. The long head also supports the head of the humerus and the lower part of the capsule of the shoulder joint during raising the arm. Part of the muscle is called articularis cubitae, which pulls the capsule of the elbow joint posteriorly during extension of the joint. This part is called a small part of the muscle, which is called articularis cubitae muscle, which is inserted into the capsule of the elbow joint, dragging it posteriorly during extension of the elbow joint. This is the long head of triceps, and this is the lateral head of triceps, and this is the tendon of the triceps. Where is the medial head? The medial head is deep to these 2 heads. This is the spiral groove. Spiral groove. This ridge above the spiral grooves gives the origin to the lateral head of triceps. And all this area below the spiral groove is the origin of the medial head. But the long head takes origin from the infraglenoid tubercle. The musculocutaneous nerve, its root value, it arises from the ventral lamina C5, 6, and 7. And it is a branch of the lateral cord of brachial plexus. Course and relations. At first, it lies lateral to the 3rd part of axillary artery, between it and coracobrachialis, as we will see soon. Then it pierces coracobrachialis to descend in the interval between brachialis and biceps. Finally, it pierces the deep fascia and continues as the lateral cutaneous nerve of the forearm. Finally, it becomes the lateral cutaneous nerve of the forearm. This is the musculocutaneous nerve. It lies lateral to the third part of brachial artery, and it pierces the coracobrachialis muscle. And here it runs on the biceps, on the brachialis muscle, deep to the biceps muscle, which is cut. The biceps muscle is cut, and the musculocutaneous nerve here between it and the brachialis muscle. Finally, after piercing the deep fascia, it continues as the lateral cutaneous nerve of the forearm. Branches. At first, it gives muscular branches, as you know, to biceps, brachialis, and coracobrachialis, the three muscles in the front of the forearm. Articular branches. The nerve to brachialis gives filament to the elbow joint. The cutaneous supply. The lateral cutaneous nerve of the forearm, which is the continuation of the musculocutaneous nerve, supplies the skin of the ventral and dorsal aspects of the lateral side of the forearm till it reaches the base of the thenar eminence. Applied anatomy. Injury to the musculocutaneous nerve leads to, at first, weakness in flexion of the elbow and also supination of the forearm. Just weakness, not loss. Why? Because the flexion can be compensated by other muscles, which will be discussed soon, especially the brachioradialis muscle, which helps in the flexion of the elbow. So the flexion of the elbow will be compensated with the brachioradialis muscle. So here we have weakness in flexion of the elbow, not loss of flexion, and also supination, weakness in supination, because there is another muscle which is spare, which is called supinator muscle. Also, we have sensory loss in the lateral aspect of the forearm. We have sensory loss in the lateral aspect of the forearm. This is an important point, which is the relations of the coracobrachialis. There is a group of events that occur at the level of the insertion of the coracobrachialis, and this is very important. From them, the basilic vein at the level of insertion of coracobrachialis, it pierces the deep fascia to become deep. The ulnar nerve with the superior ulnar collateral arteries, they pierce the medial intermuscular septum to enter the posterior compartment. The medial nerve crosses in front of brachial artery. Also, the nutrient artery enters the humerus. The radial nerve with the anterior branch of the profunda brachial artery, they pierce the lateral intermuscular septum. Also, the medial and lateral cutaneous nerves of the forearm, they pierce the deep fascia to become superficial. Also, the deltoid muscle inserted into the deltoid tuberosity, and also the insertion of coracobrachialis limits the upper boundary of the origin of brachialis and the medial head of the triceps. Thank you very much.